How many of you, if you could know if you were headed for a heart attack, would want to know? Did you know that you can know if you're headed for a heart attack, if you have a heart attack in your future? And most importantly, you can do something about it. But before I tell you how you can know if you're headed for a heart attack or not, it's first important that we watch this video to understand what's actually happening that sets us up for a heart attack. You've probably heard of the coronary arteries. These are the blood vessels that give the blood supply to the heart. Coronary means heart. So coronary arteries give the blood supply to the heart, and if there's a blockage or a blood clot or a problem in a coronary artery, that's what leads to heart attack. And so in this video that we're getting ready to watch, I want to show you a normal coronary artery, a normal blood vessel, and I want to show you one that's a moderately risky plaque or atherosclerotic plaque in the wall of the artery, and one that's highly dangerous. Because a lot of people say, I felt fine this morning, went to work, and lo and behold, I had a heart attack, landed in the hospital. I've seen that time and time again in the critical care unit. And recently on YouTube, an influencer, Kelly Hogan, shared a story of her friend, Cindy, who had been carnivore for 5 years and keto or low carb several years before that, led a very healthy lifestyle, continues to lead a very healthy lifestyle, had a heart attack, felt fine, and then ended up in the hospital and had a heart attack. And fortunately, Cindy lived through it. And Cindy, I'm thrilled that you lived through it, and I'm thrilled that you've allowed Kelly to share your story. And now that I'm able to help others, I hope that Cindy's story saves many people's lives. It all starts with really understanding, and it's easy to do, understanding what's going on inside your body if you have the setup for a heart attack or if you don't. First, by looking in your heart arteries with a simple, easy test. We'll talk more about that, but first let's talk about what are we actually looking for in the heart arteries. When plaque or disease in the arteries of the heart or anywhere in the body, but we're talking about the heart today, when it starts to form, it's what's called a moderately risky plaque. It's not a stable plaque, and it's usually doesn't start out immediately as an unstable or highly dangerous plaque. It's debris and fatty deposits and toxins and other things that are building up in the wall of the artery. And your body has the capability to make that plaque into stable scar tissue plaque, or your body can be overwhelmed by inflammation and oxidation and other factors that can cause that plaque to become a dangerous plaque. And we will talk a lot about that on future videos and more even in this video. But what I want to show you now in this video is a visual of what I'm talking about. When plaque forms, moderately risky. When plaque becomes scar tissue, it's very low risk, highly unlikely to cause a heart attack or a stroke. That's what we want to do, is help our plaque become low-risk scar tissue plaque. And then it can go the other direction. It can become an unstable or dangerous plaque. And that's what we want to avoid. So here's a video explaining this and visualizing this for us, giving us a visual for this. This is the heart diagram, and it's as though we're going to travel down into the heart, into the blood vessels that give the blood supply to the heart, and look at the blood flowing through the heart. We are traveling through the artery along with the red blood cells, the white blood cells, the platelets, everything that's in our blood. And this is a normal vessel. What's that there? This is a normal blood vessel. Here we are looking down the pipe, so to speak, the way that the blood is flowing. And this area that you see here that's a dark red or a burgundy is the inside lining of the blood vessel. And you'll see in the future examples that this is where plaque or debris begins to form disease in the wall of the artery. But at first, your artery wall here looks normal. The plaque is deposited in the wall of the artery, and your body has several ways to keep that from taking your life and causing a huge problem. Now you have in your mind a visual of what a normal coronary artery looks like. Blood's flowing through there, no problem. The inside lining is healthy. The endothelial layer, which is what this is called, is healthy. No debris in the wall of the artery. The wall of the artery is nice and thin. This is a normal vessel, no plaque. Everything looks great. In the next example, we won't see a normal vessel. We'll see a blood vessel, a coronary artery, that has some plaque to begin to develop in the wall of the artery, but your body has turned it into scar tissue plaque, the lowest type of plaque, lowest risk type of plaque that's unlikely to cause a heart attack. Artery. And now when we stop and take a look at the cross section of the blood vessel, we can see that the wall of the artery is thickened, especially on this side where the plaque is deposited in the wall of the artery, the debris, the fatty deposits, the toxins, and your body maintains blood flow at all cost. So we have the ability to dilate the artery to allow blood flow to continue. And the second thing that the body does is lays down a thick layer over this plaque so that plaque will stay encapsulated in the wall of the artery until the body can deal with it, so to speak, can turn it into even more of a scar, if you will. And so if you have a plaque, you want it to be this kind of plaque where there's a thick layer that keeps it in the wall of the artery. This could be occurring right now in my body, in your body, and we wouldn't even know it's going on. We don't have symptoms when this is occurring. But if your body deals with it appropriately, then you have this thick layer, blood flow continues, and eventually this will shrink down and be smaller and smaller. The next example is what can happen instead of this, where your body is protecting you. The body can be overwhelmed or have too much inflammation, oxidation, trouble brewing, I say, at the wall of the artery. And before it has time to develop this thick layer over the plaque and improve the health of the wall of the artery and turn it totally into scar tissue, the wall of the artery becomes a festering wound, a sore, if you will, a lesion that could likely rupture and cause a heart attack. Let's take a look at that example. This is a stable, moderately risky lesion. I want you to notice what's different about this plaque. It looks very much the same in that the artery has dilated to allow for blood flow to continue, and the plaque looks to be about the same size, but the picture here is demonstrating that there's an immune response trying to decrease this inflamed lesion, this inflamed plaque in the wall of the artery. These are examples of white blood cells or macrophages, which is our immune system cells that are sent to the scene, if you will, to try to improve this unstable plaque. The other thing that's going on here is you can see, compared to the lesion that was a stable, moderately risky lesion that we just saw, this has a very thin covering over this volatile plaque. And so this is a high risk plaque that is likely to rupture. That's where the problem can occur. If the body has time to lay down a thick covering, hide this, so to speak, in the wall of the artery and deal with it, decrease all of this inflamed, festering volcano kind of activity in the wall of the artery, then you will be fine. But if it's overwhelmed where the immune system cannot take care of it quickly enough, then the video is going to show us what will happen next that can lead to a heart attack. And this is most of the time what does lead to a heart attack. And this same process that can occur in the blood vessels to the brain, most of the time is what causes a stroke. Today we're talking about heart attacks. So this is a coronary artery that's over. It's vulnerable. It's dangerous. As you can see, that thin covering breaks loose. Oftentimes it's, again, like a wound that's swelling on your skin and you're like, I think that's going to start to leak, or it could easily rupture. Or think of like a blister that could rupture. So this thin covering is not stable enough yet. And if swelling and this immune system response inside the plaque occurs quickly, then that thin layer can break open and cause the contents that are inside the wall of the artery, the contents of the plaque, to escape into the pipe where the blood is flowing. And when that happens, your body says, this is an emergency. We have to seal this over. And the body sends in the blood clotting mechanism to seal over that opening. These are blood clotting platelets and the blood clotting response for your body to say, we're going to heal over this little leak and then carry on. And if your body just creates a small little clot on that opening, you never know what happens. That can occur too, where the clot is appropriate in size, the plaque stays in the wall of the artery, then you have time to continue to develop this thick scar tissue over the plaque, and you never even know what happens. But if it happens so quickly that your blood clotting mechanism continues to lay down more and more of a blood clot, that blood clot can get so large that then it immediately blocks the flow of blood. We'll see that here. The blood clot grows and grows, and then suddenly this nice wide open pipe where blood was allowed to flow just a few seconds before now has a blood clot in it. So it's the blood clot that's the problem, that was initially trying to solve the problem, but it becomes so large that then the blood is stopped. Or if it doesn't totally fill the lumen, it can just be a trickle of blood flow. So this is why someone can go to work and feel fine and do okay all morning and then have a heart attack and go, I don't know why I had a heart attack. I was feeling great this morning. It's because this process takes only a few seconds, or in some cases, maybe a few minutes to occur. So that is an unstable plaque, obviously. So my point about that is not to scare you. I want to give you good news, although it may sound like, how on earth can that be good news? Because we can know what type of plaque you have. And that's the bottom line. Cindy didn't have the very best test. Kelly Hogan's friend that just had a heart attack, and I see this in my practice all the time, did not have the very best test to understand if she had plaque, and if she did, how much plaque, but most importantly, what type of plaque did she have? So let's just talk about that for a minute. If you're going to know if you have a heart attack in your future, and most importantly, you're going to avoid a heart attack, you need to have the right test to understand what's going on in your heart and your heart arteries. So Cindy had a CT scan. Great. Computed tomography. This is technology that's excellent. Available at any outpatient radiology center, but the type of CT scan or CAT scan that Cindy had and that many people have is what's called a CAT score, which stands for coronary artery. Calcification score. Have you heard of that? Maybe you've had that test done. Coronary artery calcification score. Here's where the problem comes in. It's a great test and it gives you a number. You have a coronary artery calcium score, which is actually something called an Agatston score, named after Dr. Agatston. But nonetheless, if your score falls into certain categories in terms of the amount of calcium. It tells you your probability of having a heart attack in your future. The greater the plaque, the greater the calcified plaque, the greater your likelihood of having a heart attack in your future. So coronary artery calcium score is not good if it's above 0, and it's not good the higher that it gets, but it's misused a lot of times. If you have one coronary artery calcium score and you have that number, then you need to know what to do next. But what happens is, oftentimes, and in Cindy's case, she continues to improve her lifestyle, improve everything she knows to do. She sees the doctors. She does everything they tell her to do. She's sleeping well. She's avoiding stress. She's exercising. She has a healthy diet. The list goes on, and continues to have coronary artery calcium scores, the CT CAP score. And her numbers go up every time she has this test performed. And so everyone says, Cindy, your disease is progressing. But she continues to do what she's been doing, which is great. Everything she's doing is great. But there's two things wrong with saying your coronary artery disease is progressing when a coronary artery calcium score goes up. Let me explain. So a coronary artery calcium score on the CT scan is looking only, say only, at calcium. Okay? That's why it's called a calcium score, or a calcification score. That's all the CT scan looks at if you're getting a test called a coronary artery calcium score. But we need to understand that there are different types of plaque, just like we saw in our video. And we need to know what other type of plaque is there. Because remember in the video, the most stable plaque that had a thick covering over it, guess what makes up a lot of that thick covering is calcium. It may sound like a horrible thing. We don't want calcium in our heart arteries. Well, no, we don't. But if we have a vulnerable plaque with a thin layer over it, we do want everything that's going to build a thick covering so that plaque doesn't rupture. And our body's natural response is to lay down calcium and other things to make it a nice, thick, stable plaque with calcium in it. So if we're only looking at calcium, we're missing the more dangerous plaque. And so what I have to say today is that we need to understand, using a different CAT scan, what type of plaque do we have? Do we have, number one, how much plaque? Well, let's just say, first of all, yes or no. Do we have plaque? Maybe it's 0. And I've been ordering this test in my practice for about 4 years now. And my score is 15.7. And I'll tell you exactly the makeup of my score, meaning what type of plaque did I have. And we have people with less than that in my practice, and we have people with greater than 2,400 as their score, which is a lot of plaque. So first and foremost, if you get this CT scan that I'm getting ready to tell you about, you want to know, do I have plaque, yes or no? And secondly, how much plaque? So yes, it makes a difference if you have a little bit of plaque or a lot of plaque, because there's more opportunity for a heart attack. Obviously, there's more opportunity for that unstable type of scenario like I just showed you to occur. So those are the first two questions. And many of you may be thinking, well, that's just a normal process of aging. We all have plaque. I hear that a lot, and that absolutely is not true. And in my practice, I've had one patient, a 50-year-old female, who has 0 plaque in her arteries. And she's not the only one, she's the only one in my practice. So just because we turn 50 or older doesn't mean that we have to have plaque. And I will say, while she has led a healthy lifestyle, it's not 100% pristine. So there's more to the picture as what is going on in terms of what's contributing to plaque. So number one, do you have plaque at all? Number two, how much plaque? As I said, I have a little over 15 to the 7, 15.7 millimeters to the third amount of plaque. And as I said, that's a small amount compared to 2,400 millimeters to the third. And then thirdly, and most importantly, you need to know what type of plaque is it? What type? So just like we saw in that video, we need to know if it's moderately risky, if it's low risk scar tissue plaque, like the one with the thick covering, or if it's a dangerous lesion. So when plaque first forms, it's in that moderately risky category, meaning it has the capability to go either way. Your body sees it as a problem, sends in the immune response to try to take care of it before it gets out of control. And so you need to know which category. So low risk, moderate, and high risk. Here's how I want you to remember that. Low risk, scar tissue. And some of you may or may not like this analogy, but a great way to think of it is like a well-cooked, overdone egg and the egg yolk. So it's not going to rupture. It's solid in the middle. So it's either like a hard-boiled egg or like a fried egg that's well done. That's one way to visualize it. Well done egg. Moderately risky is like a over easy egg. And so it's kind of mixed. And that's how plaque is initially when it starts to develop, like a wound on your hand. It's like, oh, that looks like sort of soft. It's definitely not scar tissue, but maybe it's not bleeding and broken open yet and leaking. So that's like an over easy egg. You could poke it, but it might not easily leak out. And then high risk is a raw egg. You know that egg yolk is going to leak out easily if you poke it. It's got a very thin cap over it, and the middle is totally liquid. And so that's a high-risk, vulnerable plaque. So when you have a low-risk scar tissue plaque, a lot of that is made up by calcium. So to say that someone's disease is progressing because they have increased amount of calcium is not correct. It may be that they are just stabilizing more of the soft plaque or the high risk or moderately risky plaque that was already there. And so, unfortunately, that's the test that Cindy and her doctors followed year to year, was the coronary artery calcium score. It's a great test to tell you if you have plaque and the amount of plaque, but it's not a great test to follow year after year. You need a different type of CAT scan that will analyze the type of plaque. And then the type of plaque, even if it's high risk at the beginning or moderately risky at the beginning, when you look again, you want all of that to turn into scar tissue plaque. So what is the name of this CAT scan test? So it's not a CT coronary artery calcium score. It's a CT coronary angiogram. Y'all may have heard of that. It feels just like a CT scan for the coronary artery calcium score. You go to the outpatient radiology center and they slide you into a CT scanner and it doesn't take long. That's how a coronary artery calcium score goes. For the CT coronary angiogram, it's the same process, but they do have to start an IV to give you some contrast dye to see the blood flow through the coronary arteries. So it takes a little bit longer. Then they slide you into the CAT scanner. It's not a claustrophobic type feeling at all because your head doesn't even go in. It comes up to here and it's a more open tube. Slide you into the scanner for just a few seconds and it's over. But in addition to the coronary angiogram, which we've been able to do this test for many years in the outpatient setting, That tells us about blood flow. It tells us about plaque formation, about the amount of plaque, the percentage of plaque, how much is it blocking the flow of blood, if at all. But now, once you get the coronary angiogram, you need one and maybe two artificial intelligence analyses of that coronary angiogram data to actually follow over time. Because number one, the artificial intelligence software can tell us high, moderate, or low risk in great detail. That's how you can know if you're headed for a heart attack or not. Is your plaque that's found, whether it's 15.7 millimeters like mine, or it's 2,000 millimeters like other people, is it scar tissue plaque? Oh, that's a lot of plaque. 22,000 or whatever, 2,200 or more, or 2,000. 1,500, that's a lot of plaque. But if it's scar tissue plaque, yes, there are things we need to do, but that person isn't at risk for a heart attack right away. If it's moderately risky, it could go either way. It could become an unstable lesion and cause a heart attack. So there is greater risk. That person is headed for a heart attack until we can convert it to scar tissue plaque. And then if it's high risk plaque, they're in immediate danger of a heart attack. That's how you can know if you're headed for a heart attack or not. You need artificial intelligence software to simply read your CT coronary angiogram in great detail to tell you the details that we all deserve to know and need to know about our heart arteries. So I told you I would tell you about mine. So my 15.7 millimeters to the third of plaque, there was 2.2 millimeters of that was the low risk scar tissue, and 13.5 of that plaque that was moderately risky. So that's like the over easy egg. It's not raw and it's not well done. So it could cause a heart attack. So I've been working on all of my root causes, which once you know what your test looks like, that's when your care plan begins, because we can reverse and stabilize cardiovascular disease. We can reverse it so that you won't have a heart attack in your future. But so many people are out there making decisions on an incomplete evaluation, starting with the look at the heart. Either they don't look at the heart, or they use a coronary artery calcium score, or they use a stress test, or whatever test they're using. It is not as precise as it needs to be, and there's no way we can truly tell if you're headed for a heart attack or not, unless we have this CT angiogram with the artificial intelligence. So artificial intelligence software analysis, the largest corporation out there and the first to do this is Clearly Health. Maybe you've heard of them. So if you have a CT coronary angiogram and you haven't had a Clearly Health artificial intelligence analysis run on that data, that's what you need. And if you have had that, then you need to make sure you see someone that knows what to do with every one of your root causes and contributors, because we can turn this process around and totally look again in 1, 2, or 3 years, depending on your situation, on your findings, to make sure we're making headway in improving your heart artery disease process, reversing the process. And so that's the test that you need. There is one other company in New York, the Soren Heart Scan, and they're solely in New York, but I wanted to mention them to give fairness to everyone. If you're in New York, you can go to Soren Heart Scan and they'll do the same CT coronary angiogram and then run artificial intelligence on it using their software and their analysis. And then for both of these companies, there's a second test that you may need run. I've had less than 5 patients that have needed the second artificial intelligence analysis. And that's if whatever these findings are, if there's something that looks like it needs a stent, a coronary stent, if it looks like you could need bypass surgery, if it looks like there's something that needs to be done procedure-wise right away because the blockage is close to 70%, or maybe it's greater than 70%, or it's 50, 60%, not sure. how much potential problems downstream from that plaque there is. Then there's a flow analysis or an ischemia analysis. Those are, crazy words, but to help us understand how significant is that blockage. If it's 40%, 50%, a stent is not required. In fact, you can make matters worse instead of better if you put a stent in. There's a lot of data to support that. If we put a stent in where it's not really harming blood flow downstream. So anyway, that's the second step that may be required in the scenario. But first, you want a CT coronary angiogram, and then you want an artificial intelligence overread with Clearly Health. Most of you all over the United States would use Clearly Health. And if you're in New York, there's the Sorin heart scan. I want you to have this test done, because if Cindy had this test done, we could have said, we're missing a root cause, Cindy. We know you're doing a lot of things right, but there's something that we're missing, and we're going to find it. In my practice, we're like detectives. We leave no clue unanswered. We leave no stone unturned in finding all of the contributors to coronary artery disease, and we know them, and we can reverse the process. So I'm so excited for you to know about this technology, and I want you to have this test done, and most importantly, I want you to know what it means for you and what to do about it so that you can change your future. You can create a future free from the top killers of heart attack, stroke, diabetes, and vascular dementia, vascular-related kidney failure. The list goes on, because what you do to improve the health of your heart arteries improves the health of all of your blood vessels throughout the body. So many other things will get better as well. But first, you have to have the best information to make decisions on. That's the CT coronary angiogram at your local outpatient radiology center. You can go to clearlyhealth.com and look for providers in your area. Certainly, I'm in Texas and in Florida, and I see patients from all over the United States as well. So I would love to order this test for you if you have problems finding someone to order it for you. I believe everyone deserves and needs to have this test at age 40 or age 45, maybe earlier if they have a family history of coronary artery disease in their ancestry, their parents, their grandparents, their aunts, their uncles. Because if we have this information in younger and younger people, then we can keep their arteries pristinely healthy for their whole life. But whatever your age, get the test, because we can do something about it. We can turn the car around so you're not driving towards a heart attack, but rather moving away from it, creating health in your body.